and disabled population. And basically, we were talking about, at this point in time, would look like you'd have to have an actuarial construction on the out-of-Medicaid program, if you will, in terms of the private option people specific to Arkansas, and the Medicaid people that are on traditional Medicaid, and then risk adjust between the two. And that may sound like Greek or may not be of interest at this point, but no one's ever done that. And then put a budget together and went to the federal government to ask for funding on that basis of actuarial construction. So I thought that was something to note.
Did you all both agree with his notion that there is the potential under a 1332 waiver to do premium support or tax credits for private employees or employers to help drive people into the workplace insurance market?
I absolutely do. And I think that to answer that question, the more intriguing thing that I was thinking about as I heard that, Senator, was could you also do that in the guise of an 1115? Now, the 1115 is not as broad. You're talking about the entire health care program when we start talking about a 1334, much larger. But if you want to look at 1115 and while we're negotiating, the one thing that he did say, because I've been there with governors and I've actually been in CMS and IMB, he's absolutely correct on the negotiation. A lot of it depends on the negotiation. And they come down to the last few weeks, and we can have a governor making a call. I've seen where the governor's made a call to Secretary Leavitt, and something was put into the contract. It's a 5-year contract. So 1115 is the same, it's a 5-year contract. But could you take the guise of 1115 and offer that same premium support by doing some type of savings initiatives and identify a benchmark and be able to take those funds and offer that type of premium support as well in the guise of that 1115. So those are the things I was thinking.
Right. Representative Hammer, you have a question?
Thank you, Mr. Chair. When you went in and submitted your RFP, did you have the concept of the 1332 waiver and everything that might go with it being enlightened as up to this morning? Did you have that included in your RFP or in your thought process? Well,
in our thought process, yes, but our idea was the RFP was more addressing the Medicaid program and bringing ideas as private option, but also ideas of how that whatever alternatives we give you will impact the broader population. It wasn't, let's look at the whole reenacting of the Affordable Care Act here for Arkansas Affordable Care. That's something that I think could be the next step. That's kind of how we looked at it, Representative.
Well, what I'm wondering is, under the RFP that you quoted and the cost price that you gave us with the new conversation or the additional conversation, 1332, do you believe you're going to be able to wrap that into your current RFP, or you think that might drive your price up?
I mean, I want to continue to talk to the committee about that. To answer that question now, I don't do a lot of analysis on 1332 potentials. And if we provide our solutions for you, there could be an option that you start looking down the road, move down the road. It will probably drive the price up after October, because then you're going to have to make the decision. Do you want to continue to have us involved in any type of labor negotiations? Do you want to have us involved in helping write the actual contract for the much broader? So yeah, to answer your question, it would be a really deeper discussion.
Okay, a couple of quick ones, Mr. Chair. The data that you've requested, was there any really new data, or is it just pretty much regurgitated from what has been asked for before? The data that you've asked for, is there anything new based on what we've heard before as committee members in the past?
Much more comprehensive.
Okay, all right.
Much more.
All right. And then you mentioned about Congress and, submitting the waiver. In your opinion, are we going to be better off to submit the waiver regardless whichever format it gets presented in for negotiation? Are we going to be better off to present it even though it may go against what currently is in there? Because based on testimony I heard this morning, we got the chance to negotiate. But even if it goes against current law, do you think that we ought to ask for forgiveness instead of permission?
I think that we would be remiss if we didn't give you an option that you can seek changes to the law. And I think that we have to also give you options that is within the current framework of the law. So I think we're going to give you both of those. And, you know, if you ask us what will work, we're going to try to give you really good, reliable solutions. And I know that the chairman mentioned earlier, everything the task force tells us resonates with us. And I continue to keep my team informed. When the chairman said he wants actionable plans, actionable ideas, not high pie in the sky thoughts. I mean, we're really trying to make sure that we can give you the best actionable idea. And the only issue is you've got to be mindful of the fact that the bureaucracy, the federal bureaucracy, is a real problem. When we're going to negotiate waivers, you can see that the director really told the same thing. It could take a while. The benefit of what we did in Rhode Island, because we knew how difficult it was bureaucratically, was to be able to get a provision agreed to that said the state can move forward on any changes within the program that the legislature believes are needed without getting CMS approval ahead of time, unless it was an actual state plan amendment or a waiver. So there's a lot of things you can do, but today, you're handcuffed to move forward and do some other things because of all the bureaucracy. So that's one of the things that we're going to be looking at.
Thank you, Mr. Chair.
Okay, have you all finished your presentation?
Yeah, I think the final thing would be any task force member that wants us to meet with them, you know, to contact either through Joe or yourself, Mr. Chair. We want to be accessible and available to all members. So we've already had some that we're reaching out to go meet with them. We want to hear what their thoughts are. And it would be really helpful if we hear from task force anyone who wants to move us earlier in the process, because we're really intensive reviewing research, data, and the beginning, because we want to start developing some ideas as we get into the summer.
Could you give us, and that's, I think everybody should have an email from Mr. Stephen, and if not, Mr. Price or myself can get it to you. Would you give us an idea now of your timeline? And I think you know when our next scheduled task force meeting is, but as far as what you think, I know you mentioned interim reports, and can you kind of give us an idea what your deliverables you see bringing to the task force over the upcoming weeks and months?
Thank you. That's a great question. The very first month, we have a status report that doesn't, under the terms of the agreement, doesn't really require us to give you a lot of information, but we're going to. We want to make sure we give you as much as we can up front as of what we're seeing. So the first status report, which is 1 month from the contract date, we'll have some of the initial findings within the program. Some of the things that we're looking at the data, identifying in the data, the analysis. What we're identifying for potential opportunities as you go forward. So it'll be very comprehensive in the sense that, you know, we'll look at every area about the RFP in Section 3, and we'll try to give you an idea of what we've been able to determine so far. And if we do that along the way, Senator, I think it'll be really helpful for both of us, and we can react to some things, and we can know if we're heading in the right direction.
Okay, I think that would be good, and we're going to give you our next meeting date here in just a little bit, and I'll go through some of that with the task force members before we quit. Senator Irvin, you're recognized for a question.
Thank you. I'm over here.
Okay. Hi, Senator.
I'd love to meet with y'all. Definitely. But the question, one of the questions that I had with Dr. Chen is, you know, wrangling with the things that are possible. And I think we're focused on 1332, and clearly the 1115 waiver is one that I wrote into the original legislation and negotiated on the final day. And so, you know, I know that there's a lot of possibilities out there, but I also, you know, I'm very interested in other possibilities beyond that, and a combination of sorts, and so how those things could all kind of work together, and particularly looking at some of the things that other states may not be doing, but that our state is actively trying to do based on the ideas generated by the folks within our state, and different programs that are being initiated, and different things and different avenues of utilizing our own resources. One of the questions I asked from a lot of folks was, I'm not really interested in regurgitating or replicating what's happening in another state. I'm really interested in seeing, okay, here's our government, you know, and what are our main tasks and goals and objectives with healthcare in Arkansas. And I feel like if we could kind of start to define and figure out what's our main objective and our main goal, what we're trying to achieve, those are big questions and broad questions. But I do feel like we got to kind of have that. And Dr. Chin kind of did allude to that. You know, he said, figure out what your goal is, what your task is, and then the individual pieces that will fit into that. So, you know, I don't know how that kind of brainstorming or is going to fit into what you're doing. And so I'm just curious as to kind of what you think about that process and how that might be built into what you're going to be doing with evaluations.
Well, it's a really good question because it goes to the heart of your vision. For example, when we were in South Carolina on a project for Governor Haley when she first took office, and I'll get to what your question is, their big issue was really centered around the long-term care aspect. And they wanted to have more seniors living at home in the community for a longer period of time, and have a continuum of care, and able to offer assisted living and some other alternative solutions. That was one state. But what she really liked was when we came in with a plan, and it was branded 50-50 in 2020, and set the vision for continuing to make all the reforms needed. And that is by 2020, 50% of the seniors will be in the community, 50% in a institutional focus. Everyone will have good quality of care. And so to answer your question, the idea is really a good one because you want to first have what is your vision for the state of Arkansas and the people that you serve. And you want to be the best, the healthiest state in the region in 5 years, 4 years. You can have the national health status data, and I will provide some data for you, but you want to do everything you can to meet that goal. So the idea is the way to fill in the strategic plan, the objectives to actually make it happen.
Mm-hmm. Thank you. And
I really like the question.
Well, I appreciate that. And one last question is, what do you want from us specifically, individually? Like, and I'm asking you to ask me the question now.
Okay.
And to ask all the legislators.
I have a question.
I mean, what are the questions that you would want to ask us so that before meetings occur, there can be some preparation, I think, from any legislator. But I would like to know that, or what your questions are for us.
The first thing I think, I just want the task force to understand, looking at the first questions that came out, there are a lot of questions that are coming out that are a little outside the scope of the RP. I just want understanding that we can't be going in too many directions when we have a very short time to get you what you need. If you can understand that and we're going to meet the scope and we're going to do everything we can within our power, that would be great. The second thing is, I want, and Richard, we love going out to the community. We were down to Mississippi during the project to actually see and feel what it was like. Because we're from here, but we want to feel what it's like, and we're going to offer you good solutions. So we want to be able to say to you, what in your community do you see as the number one issue impacting the health status of your community? What is the most important issue you're hearing from your constituents that impact their ability to have good access, to have the proper health care, and we're talking about a lot of folks that don't have a lot of means in the Medicaid program. What do you see working just as much as what isn't working? So we can capitalize on some best practices as well. Community-based, Representative Murdoch and I were talking, and Richard earlier. What's working in the community? So community-based health alternatives, community-based structure. Because the state, sometimes the answers aren't here, they're at the local level. And that's the overriding thing I would give you is tell us what's working at the local level. Richard?
No, I don't have anything to add to that. We want to know what works for individual families in communities that keep family members home that may be challenged with illness or cognitive disability. We want to know how your community infrastructure, your social clubs, your faith-based community, your local hospitals and your FQHCs, your community centers work together at the community level that help people improve their health status and support their decision-making about staying healthy.
Thank you.
Okay. Members, do you have any other questions for the Stephen Group about what they've been working on or doing? Let me just add something that I think would help us. This questionnaire that you all have and that you have access to there is what was used to generate the RFP. Basically, Jill took this and tried to incorporate, group these together, put statements in that would allow us to ask these questions under the scope of the RFP. Now, I realize some of these may be a stretch to get a complete answer in the time frames that we're looking at. But I guess what I would ask is, some of these I think also could probably be done in a matter of days or weeks. Would it be possible on our upcoming meetings to kind of have a report on the progress of these particular questions? For instance, how much does Arkansas spend on prescription drugs in these programs? So start putting the holes in on these, because again, this is what I think members said, we need this information. And so, and if it's, undeterminable or not within the scope of our presentation, our bid, then fine, put that in there, but so we know what we have and what we will not have as we move forward. I don't expect it all for the June meeting or July meeting, but as we move through this next few months, hopefully we can begin to fill in these pieces that people ask for.
Absolutely.
Okay.
We'll do that. Our very first next meeting, we'll have a lot of answers for you.
Okay.
And I'm sorry, but I also wanted to say, we're also, and I know we've talked before, John and Richard, and you guys aren't confused about this, but I want to make sure we're saying it in public too. We're not looking for you to be gophers for our questions. I mean, obviously that, the fact that we're asking them means we need to address them. But you guys are playing a much bigger role than that in terms of assessing the situation and laying out the data that is leading you to conclusions, so that you can bring us recommendations that we can bring into play. And so all those questions we've asked, maybe good or maybe bad, they're missing things that you can figure out, and we're looking for a roadmap and a host of recommendations.
Yeah, I would like to just say that we understand that. And for example, when we met with the department representative, they've been very forthcoming on reports, information, but we've come across some things that we're looking at in our team that nobody's looking at. And I will say that, and this is one thing I should have said earlier, there may be some areas that we'll let you know about right away, and we're not going to wait for the next meeting. So I guess, Mr. Chairman, we want to look for some direction in that. Should we just continue to contact Jill and work through Jill so that everybody can get an idea of what we think that the task force should know about? How do you want us to operate on that?
I think it's a valid question, and let me just that leads into the discussion that we had earlier. Our next meeting is set for Thursday, June the 11th. And as I think we talked about at our previous meeting, right now we're going to plan to meet every Thursday before Legislative Council. So the July meeting right now would be Thursday, July 16th. We fully anticipate having to accelerate that meeting schedule as we begin to get closer to it, and you all haven't had an opportunity to collect more data. And if there is a need that you feel that we need to meet prior or subsequent to any of these meetings, let the co-chairs know, and we will take the steps necessary to schedule an additional meeting other than what we have right now on the books. The other thing that we would ask from you is input into what you would like to see on the agenda items for those meetings. Up until this point, the co-chairs have been trying to take input from the task force members. In fact, we have an item on the agenda today from one of our members to give them the tools and the information they need. But as we begin to move forward, and as you begin to do, as Representative Collins said, think about areas that we should focus on, by all means, let us know what we can have on the agenda that might help you and help us in the upcoming meetings. So that's kind of the schedule that we have as we move forward. Would you like to add anything to that? So again, right now, you've got until June the 11th, and again, if there's a need, if you feel like there's something that we need to get together about and meet a couple of days in a row or subsequent, prior to that, we will schedule the meetings as necessary. And as I said, and I told all the members, as we approach September, October, I fully expect us to be meeting 2 or 3 times a month, if not more. Let's see, Representative Murdoch, you have a question? You should be on.
Thank you, Chairman. Going back to the questions that you had mentioned, or the Chair mentioned that we're asking you to answer, and you said some of those questions may be outside of the scope. It may be necessary that we kind of define that at some point so that members will know what to expect from what you're going to give us from these set of questions, if that makes sense, Chairman.
What I can do, Representative, if that's okay, is in the initial response that Senator Hendren was asking for, if there are areas in that response that we think are either outside the scope or are going to require a lot of additional analysis that we didn't anticipate, we can just put something in there that says that as we respond to the questions, if that works for you.
Thank you. Thanks, Chairman.
And one other thing I want to clarify, Representative Hammer suggested this, and I think it's a good idea, because I know members of the legislature, members of the task force may want to meet with you, and I guess what we need to clarify is in your presentation for maximum guaranteed price and that number, have you built in and are assuming those type of meetings will occur, and when you bill for the hourly rate, that is already built into our anticipated?
It's absolutely already anticipated.
Yeah. Okay, so I just don't want members to think that if you had a 2-hour meeting, you'll end up with a bigger bill at the end.
No, I'm an attorney too, and I know what billable hours are like.
Okay.
Believe me, we're going to make sure we deliver within our budget.
Okay. All right, any other questions of, and again, this is an introductory meeting, and I think a chance for us to establish what our expectations are, and I think Senator Irvin's questions are valid about if you have things you need from us, like meeting schedule and meeting process, to make that happen, because we expect at our June meeting you guys will have had a time to put together some of this information and give us a thorough briefing on how things are going. And again, what I would also tell you in the interim is if there are any obstacles to you collecting data or to interfacing with, let the co-chairs know, and we'll try to communicate with the task force and try to assist you any way we can to get that going.
That has not been an issue, so.
Okay, if there's nothing else, let's move on to the next item under item E, which is we have some subcontractors that we need to approve. I think you want to explain briefly what those are, and then we'll probably just approve those as a batch unless there's some objection.
Okay. Well, there are 3 subcontractors, and the first I will just start with is when we talked about the data eligibility scrub. We're working with 2 subcontractors on that scrub, and one of them is LexisNexis. And LexisNexis is going to be looking at the beneficiary eligibility file. They actually have one of the largest databases looking at identities and social security numbers, and they work for the federal government. They provide information to the FBI. They also work with your state police. So they're already in the state. They have a lot of data, and they're going to actually be working with us on the scrub. We also have, because I know from being a response as well, and from my own background, Richard's long-term care is a big issue. And I want to make sure that the folks that are going onto your long-term care system, that there's a proper asset check, so that individuals that may have bank accounts that are beyond being not disclosed, are there some issues there? I want to be able to find that out for you. And so we have another vendor called Acuity, which is the Social Security Administration, federal government's contractor that checks banking assets of all individuals in the United States of America that ask for disability benefits. So before they get disability benefits, they have to go through Acuity's check. Both of those vendors are going to help us with the eligibility scrub. And we're going to be able to look then, not just focus on the whole beneficiary file, but actually laser focus on some of the long-term care areas which we see as a potential opportunity for you. And then the third one, obviously, is the Arkansas Foundation for Medical Care. Ray Haney has been a personal friend of mine for years. We worked together when he was a Medicaid director and I was a commissioner. And I didn't know that Ray was even involved in another bid. And at the end of our presentation, I happened to see Ray in the hallway, and it was just great to see him. This task force said, clear message to us, can you hire within Arkansas? Absolutely. We do that on other projects that we have for states. So we have an administrative assistant that we'd like to bring on from Ray's business that's going to help us. They're going to help us with scheduling. They're going to help us a lot with making sure that we meet the right people and just knowing who to talk to and where to go and make sure that they'll help guide us. The policy and the discussions in our group and all the things that we're doing, the analysis, that's outside of that scope of that subcontract. It's more for those administrative functions and just help and guidance. And those are the three, Senator, subcontracts that we would ask for approval on.
Okay, we've got a question, and then we got a motion from Senator Chair. I've got a couple questions. Representative Hammer, you're recognized.
Thank you. Just to make sure all the T's are crossed and I's dotted, and nothing comes back to bite anybody. In the original RFP, was it not stated that the subcontractors that were going to be used had to be included in the RFP, or what was the loophole written into the RFP? Because I think you're mentioning, were all three of these subcontractors listed in your RFP when you originally presented it?
No, the RFP said that if during the course of the term you want to bring on subcontractors, that they would have to get the task force approval. That's the way I read it.
Is that the understanding of the chairs?
We can ask, let's come back to that question in just a moment. I want to let Representative Ferguson wants to speak, and then Jill, would you be prepared to answer a question about the RFP thing for Representative Hammer here in just a moment? But Representative Ferguson, you're recognized.
Oh, thank you, Mr. Chairman. Yeah, and I've talked to several of you personally. I just wanted to disclose that my husband, Scott, is on the board of AFMC. So I will recuse myself and not vote on this subcontract. And as he pointed out, I didn't want anyone to think that they were in any way involved when I voted for Stephen to be the consultant, because they were not.
Okay, thank you, Representative Ferguson, and we appreciate the disclosure. Jill, would you mind coming down real quick and answering Representative Hammer's question about the requirement in the RFP for subcontractors?
Is there an additional cost?
This is part of your contract, and yep. Would you like him to restate the question, Jill?
Yes, please.
Representative Hammer, please.
As I understand it, when I was reviewing the RFP request and everything, I think it's on page 7, it talks about that any work of the subcontractor vendor must disclose that same information, and it says the responses to this RFP must include a list of subcontractors. So my question is, of the 3 subcontractors that we're about to batch and throw into this, were they all listed in the proposal that was made by the Stevens? And if not, and there's a new one being added, is there a provision within the RFP so that we as a committee are above reproach as far as, working within what was stated in the RFP?
There were, at the time that the proposal was submitted by the Stephen Group, they did not list any subcontractors. However, now that they are choosing to use some, the RFP provides that the task force has the right to approve those. So that's the process that you're going through right now. Now that it won't add any cost to your contract, but they have a few that they want to use, and they're presenting those to you for your approval. You can approve or not approve.
All I want to know is we're going to be covered as a task force, because it sounds like in one part of the RFP it said you had to submit the list, but in another part of the RFP it says, but if you don't, we've got this provision to make sure that we can take on anybody new after the fact. Is that
right?
fair?
I think that it would be our interpretation that he couldn't go and use any without disclosing them to you, but now that they are choosing to use some, they're disclosing that. And it doesn't change the scope of their work, it doesn't change their contract price in any way, so it doesn't actually impact our contract with them.
Right, because the cost is the contract is actually between the Stevens Group and whoever they want to sub with. We're just giving our blessing and no
Yes.
additional cost, okay? All right, you didn't have did you already have previous conversation with any of these subs before you submitted the RFP that you didn't list them on your original RFP when you submitted it, or can you explain the timetable of which you came up with these three as before the RFP was presented?
I think it was during the hearings, when it became clear that what you all wanted was that complete data scrub. We wanted to make sure we brought on the right team to do that. The Ray Hanley's organization was after the hearings, after the RFP, because I had met Ray in the hallway, and when the chairman had said, "Are you going to hire people from Arkansas?" I was immediately thinking, we got to find some folks here to help us with some administrative functions.
Did you have anybody else in mind before you submitted the RFP that you waited till after you made the proposal
On eligibility?
work in-house?
On the eligibility scrub?
Well, on any of it?
Yeah, we were going to do it in-house. But the eligibility scrub in-house was going to be a little different than the full-fledged eligibility screen file. It was going to be more looking at the processes and the systems and what we had promised in the RFP.
Okay, Ray's group, what specifically are you using them for again? What, that you're having a contract with them, what's the scope?
The scope is administrative functions, setting up meetings, being able to be available for us when we need maybe 10 meetings and take a few notes for us if we need it, and also identify who the key folks are in the state that we should be meeting with, helping us, to guide us, Hospital Association, a lot of folks that they've been kind of just now doing that before, actually being paid by us, but that's why we want to bring them on, because their knowledge is important.
Okay, all right, thank you, Mr. Chair.
Okay, Representative Meeks.
You can go ahead and pass over me. Representative Hammer got my question. Thank you.
Senator Alvin.
Thank you. I want to say something that the legislators that you have sitting in front of you, I don't want there to be a third party